Hello, my name is Desiree Tait and I'm a nurse lecturer at Bournemouth University and the lead author and editor of Acute and Critical Care in Adult Nursing. So what's this book all about? Well, it's about acute and critical care, and that's concerned with the assessment, management and prevention of clinical deterioration in those people who are really very acutely unwell. And people can become unwell and deteriorate in any clinical setting. And this book gives the reader an opportunity to learn why a patient's condition can change, how to assess and prioritise care, and how to communicate safe and effective practice. Each chapter focuses on a scenario and takes the reader through the patient's journey, focusing on the biopsychosocial knowledge and skills that are needed really to make effective clinical decisions. There are quick reference guides to help with that decision making, and also exercises to help the reader to rehearse decision making, and feedback is provided at the end of each chapter on those. So this third edition continues as part of the Transforming Even Nursing Practice series and is fully updated to support the NMC 2018 Standards of Proficiency for Registered Nurses. It's relevant reading really for all student nurses and nursing associates who care for adults, and all of the chapters have been comprehensively updated and aligned to the most recent guidelines and evidence available at the time of publication. Each chapter really does support teaching and learning by using a critical and a questioning approach to assessing and managing care. And chapter 1 is the chapter that sets the scene, with quick reference guides included on all of the elements of ABCDE assessment, and also normal and abnormal values in relation to assessing and measuring blood results and so on. There are new and updated patient scenarios whose stories unfold as the chapter progresses. And these stories are told from the perspective of a student on placement and really do highlight some of the learning opportunities and experiences that you can encounter as a student on your learning journey. Readers are encouraged to reflect on their own learning and practice and recognise the importance of assessing each person as an individual in order to promote that safe and effective person-centred practice. There are chapters on breathing, respiratory assessment, cardiovascular, shock, sepsis, endocrine, and so on and so on. So all of the core physiological systems and causes of critical illness are identified, and there are, as I say, there are patient stories related to each of those. So should you get the opportunity, I really do hope that you enjoy reading and learning from the book and these clinical stories as you continue to develop your role in nursing. And thank you very much for listening.